Hello and welcome to week 3, live chat, lunch and learn. I hope you're having a great week. It's cold, but that's to be expected at the end of January, isn't it? So this week we're talking about career paths. And I wanted to make certain that I bring to your attention that while you are in a program for medical records coding, which can lead you to an excellent career as a medical coding professional, you also may not be aware of what types of facilities you can get a job in, because most people just immediately think hospitals or doctor's offices. And of course, those are the two biggest, but look at all these places you can get a job with these skills that you're learning here. In addition to hospitals and physician offices, ambulatory surgical centers are an excellent place for you to use your skills and earn a great living, also known as same-day surgery centers or outpatient surgery centers. Billing companies, there are actually companies, freestanding companies that are dedicated to coding and billing, creating the claims and follow-up for physicians' offices for the most part. Walk-in clinics, urgent care centers. Now, you may look at the urgent care center and say, well, that's owned by my local hospital or something like that. So they would have their own coders. And yes, but remember, hospitals not only have these multiple entities, but each of these entities needs coders with different knowledge, right? So first you have inpatient and outpatient, but then you also need to be able to understand the nature of outpatient surgery, emergency care. Don't forget those external cost codes, very important when you're working in an urgent care center, right? Or an emergency department. Third-party payers. You can go work for the insurance companies. You have that knowledge. Attorneys at law. I'm sure that you see the commercials for accident attorneys. You know, those who say, you've been in a car accident, call me, I'm going to get you $16 million. Okay. Well, any attorney that is handling a case that has to do with illness or injury needs somebody who understands medical coding, who can look up this code on this claim form and tell them what it means. You can also understand and interpret the physician's documentation, very important for them to be able to move forward with an accident case, an illness case, a malpractice case. So if you have a combination of interest in the law and in healthcare, like I do, okay, I've worked with several attorneys on, actually, I worked with 2 law firms that were looking into illegal and fraudulent coding practices in a billing company and also a walk-in clinic. And man, I got to tell you, I was on their side. That is just so wrong, very wrong, to take advantage of individuals. It was at the beginning of the pandemic, especially. So, okay, educational institutions, see me, certified coder, certified coding instructor, right? Okay, government agencies, the Veterans Administration, which has locations throughout the United States, is always looking for good qualified coding individuals. And I have some former students working at the CDC. Short-term and long-term healthcare facilities Also, nursing, that would include, skilled nursing facilities, SNFs, even assisted living facilities. So there are lots of opportunities beyond just hospital or doctor's office that you can take your skills and seek out a place to work. Now, in addition to this, and this is like super cool, is as you look at your future, your career, you can be a coder and also have other specialties to broaden the opportunities for what you want to do. This is where you want to do it, what you want to do. So AHIMA has this excellent thing on their website called the Career Map. All right. This is the URL for it. It's very simple. www.ahima.org/career map. Okay. And this will show you all the various opportunities and jobs within the HIM, Health Information and Informatics Management umbrella. These are all our jobs as medical record coding specialists, and augmented to do other things with the information. Now, AHIMA has broken it down to 4 categories, okay? Coding and revenue cycle, that's us right now, okay? Informatics, data analytics, and information governance. And it all depends on what else you like in addition to the process of coding. Now, here at this, on this website, they also have this map. This is so cool, okay? Multiple job descriptions. So we just talked about 4 extended categories that you can use all of these skills that you're learning in this program. And right there at the 12 o'clock position is coding and revenue cycle. So you have your coding skills. You also have your billing. Okay, that's revenue cycle, has to do with managing the claims, follow up for rejected and denied claims, processing, auditing to make sure that everything is being done correctly. Okay, look at all those dots. Each one of those is a totally different job description. Okay, then at the 3 o'clock position, you have jobs available, and these are each one of those dots is a job description telling you more about what this job may do in informatics. At 6 o'clock, you have data analytics, and at 9 o'clock, you have information governance. So when you have a chance, I strongly recommend you just go check this out. Coding is a wonderful career that you can do for your entire career. And as you are already learning, being in this program, it changes. So it's not something you might get bored with, okay? As you continue to enhance your skills, right? However, I also want you to know and understand that there are branches off of this tree path, okay? I know, I just mix my metaphors. It's a tree with branches, or it's a code path with offshoots of, you know what I'm saying, okay? So check it out and be thinking about what else, how you want to develop your career. Because hopefully it's going to be many, 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 many years. And I want you to get up every morning and say, oh, goody, I get to go do this. And they're paying me? How fantastic is that? Okay. All right. So This week is chapter 3 homework. Very big surprise. We're in week 3, you're in chapter 3. See how that works? Okay. All right. Also included in this week's content is information about medical coding national certifications, and as well as information specifically on the CIC, Certified Inpatient Coder exam. Lots of opportunities, and remember that a national certification on your resume is like a golden seal of approval. Not just me as your instructor, not even just CCT, but a national organization that wants nothing but to welcome in only the best that can represent our industry and take care of our patients. And that's the most important thing. And remember, we have an investment, not only our personal investment in building your career, but our personal investment, because every one of us at some point will become a patient. Okay. And trust me when I tell you, what goes around comes around. All right. So, any questions, concerns, just want to talk about this, send me an email. I can answer your questions via email, and then you can print them out. We can set up an appointment to talk on the phone, or we could do, well, nobody Skypes anymore, do they? But we can Zoom, we can FaceTime. I'm very technologically flexible. Whatever's easiest for you. I'm here to support you, your learning, and your future. Okay? All right. Have a great day.